Hi, everyone. Welcome back to the Dish on Aging. This is episode 6. Today we will be discussing the topic and answering the question, what can I do if someone that I love refuses mental health treatment? But before we jump into today's topic, I want to discuss how the COVID-19 vaccination process is going here in the Philadelphia region, Bucks County, Montgomery County, Philadelphia County. Okay, so where can I start? Where to start? So much has happened in the past week. I'm trying to remember where I left off at the end of the last video. Where we are right now, today is January 31st, is in the state of Pennsylvania. Enough doses have arrived to vaccinate 750,000 people. That leaves about 12 million of us left. There are about 3.5 more million people who are at the front of the line, as it were. We are in the first group of people eligible for vaccinations. That's myself, as every healthcare provider, anyone who works in hospitals or long-term care facilities, and also anyone who resides in the state who is age 65 and older or between the ages of 18 and 64 and lives with a chronic medical condition. I was encouraging everyone, I believe at the end of last week, to have, if you're not used to using the internet, have someone in your family get you on the county list so the county can call you when a vaccination comes in for you. Vaccinations are coming into the state. It's only a few thousand a day. And so it is really going to be up in the air in terms of when we will receive our telephone call that the county has a vaccination for us. What I want to encourage and it really will, it might take several months. They're even saying up to a year. And keep in mind, that is just to vaccinate those of us who are at the front of the line. We are about 28 to 30% of the population of Pennsylvania. So, what I encourage everyone to do, most of you have already done this. If you haven't done it, have somebody in your family sign you up through the internet to get your name on the list. The other thing I encourage you to do is to be ready for the call. It's going to be a hurry up and wait type of situation for the next several months for many of us. We just simply need to wait until the state receives new vaccinations. They have a number of sites that are set up and ready to go. When there is a vaccination for you, the county will contact you or whoever signed you up, whatever the contact number is, either by telephone or email to let you know where the date, location, and options for time. Here in Pennsylvania, the vaccinations are being set up by appointment only. Over the weekend in other states, you're seeing long lines. I guess a refrigerator broke and thousands of people had to get vaccinated between like midnight and 2 a.m. in one state. And they actually had everybody in line and got all of the vaccinations in people's arms. That's an extreme and extenuating situation. I'm hearing seniors are worried that they won't have the stamina to sit for hours in line to get their vaccination. That's not how the vaccination distribution is happening here in Pennsylvania. It is going by county. Also, the county is going to be setting up to deliver the vaccinations specifically to senior housing buildings and also continuum care buildings, that they might be a little bit different from hospitals and nursing homes. So efforts are going to be made to bring vaccinations directly to seniors. Everyone is just waiting until the vaccinations are manufactured and arrive in the state, get distributed to the counties, and then go to locations, and then the counties can start calling you to tell you that a vaccination is ready. So it's a time to be patient. It's a time to be prepared in the sense, I think it's important for everyone just for your general health. Make sure to get up every day, get yourself dressed, washed up, ready to go in case you get that hypothetical call. They say, we have a vaccine, we'd like you to come in tomorrow. That's just a for example, because the state may not have advance notice when vaccinations arrive. I want everybody to put in your mind right now when you receive that call that there's a vaccination for you, that you have one answer to that call, and that answer is yes, where, and when. Have a notebook and a pen by your phone so you can write that down. Hang up the phone, and then if you have to set up a ride, set up a ride. If you have to reschedule or cancel medical appointments, you do that. I want everyone to avoid, when you receive that call, to say, I have to call my son to see if he's available to drive me. Can I get back to you in 10 minutes? Because in that 10 minutes, there's probably 10,000 other people they can give that vaccination to. So if you receive that call, the answer is yes, when, and where. You hang up the phone, and then you rearrange the rest of your life. So we're not in panic mode. What I want to encourage everybody to focus in on is priority mode. Somebody this week was telling me they were frustrated with Dr. Fauci saying everyone needs to get their shots. And the person said, but we're hearing we may not be able to get our shots for a year. Why are we told to get a shot? Well, the reason for that is because there are people being offered a shot. The shot's right in front of them and they are refusing. Most of those are employees of long-term care facilities and hospitals. There are a few nursing home residents, very few, but some are refusing. And that's who Dr. Fauci is talking to. If somebody is standing in front of you with a vaccination in hand, already, I understand some of you just don't feel comfortable, but if you feel comfortable, the answer is yes, I want to get my shot. And we're in this unusual situation of it's going to take time, and there's waiting lists, and now's the time to, if you need a ride, when you get that call and you don't know when the call is going to come in, this week start talking to friends and family. Who can I call? I don't know if we're going to get 2 weeks notice, or someone will call on Monday and say, we've got every appointment open for the next 2 weeks. I don't know if the calls are going to come in like that, or if it's going to be, we got 4 o'clock this afternoon, 8 o'clock tomorrow, which one do you want? So if you're dependent on somebody else for a ride, start discussing this with other people. Keep in mind, this is going to be the type of situation where any of your family members who work, they are going to be able to leave work under family leave if they have to. If you receive a call, there's a vaccination for you, you got to come get it within 2 hours, your family members will be able to leave work to get you to that appointment if they are the only person who can get you to that appointment. So that's how to think in terms of making getting your shot a priority and not a panic. As you're listening to the news, you're hearing we've got these new strains. They are here locally, Bucks County, in Philadelphia, even though they were first identified in England, Brazil, South Africa. They're all here in the United States. What's happening, we're now in a race of time. Get as many vaccinations in people's arms as we can before these more, what do you call, they spread faster vaccinations. Some of them also may be slightly more harmful as well. So I want everyone to remain calm, be prepared. That's how you cope. Be prepared, have your plan, get up every day. And like I said, this might be every day for the next year. And say to yourself, I want to be ready should that call come in first thing tomorrow. The vaccination's here for me. I want to be up, dressed, and ready to go. And that's going to be generally healthy for you anyway, to have that structure to your day. Okay, so that is my update this week, January 31st, 2021, on how the vaccinations are going here in the Philadelphia region. Okay, Now to our topic of episode 6, what can I do if somebody I love is refusing mental health care? I'm going to abbreviate today's presentation in the interests of time. Um, this is something I have been thinking about for the last week in anticipation of today's presentation. And the answer is essentially there is really nothing you can do. If somebody is refusing any type of treatment, whether it's mental health care or any other type of care, there is nothing you can do to get them to go to care. But there are things you can do to be supportive. And I want you to go back to that episode when I talk about how can people, family members support other family members during the pandemic. Go back and listen to that again. It's about listening while not talking. It is about no judgment in what they're saying, and it's about understanding. So, using those supportive skills to help you understand your loved one's perspective will be very important to informing you on how to take action. And I'll get back to the action in just a minute. One of the most important ways that we can influence the behavior of somebody in our family, somebody that we love, is by demonstrating that behavior ourselves. Okay, stop and think about it. That's going to be harder than it sounds. Most of us, every time we go to the doctor, we are told something. We are told to lose weight. We are told to start exercising. We are told to, I don't know, follow the diabetes diet more closely. We're told to focus in on the heart healthy diet. By the way, I think it's 2/3 of Americans age 35 and older meet criteria for obesity. Um, and so our doctors oftentimes have requested that we lose 5 or 10 pounds. And I know what you're all thinking now. Well, we're not talking about me, we're talking about my loved one who's refusing care. Well, here's what the problem is we need to respect, understand, take responsibility for, and embrace that the reality is that most of us, if not all of us, on some level, either refuse care outright or don't follow what our doctors say in terms of our actions, even though we know if we did what our doctor told us to do, we would feel better. We would be in better health emotionally and medically, and in some cases socially. So, one of the most important things we can do by indirectly influencing our loved ones who are refusing care is we can step up to the plate and sharpen our focus. You don't have to go bragging about it, telling everybody you're doing it. People will notice. If your doctor has asked you to lose 10 pounds, you focus on doing that. And it'll take notice, and then if somebody asks how what's going on, why are you doing it, what are you doing, you say, "Hey, my doctor said I need to lose weight. I'm losing like 2 pounds a month, and my blood pressure's coming down 2 points a month. And so I'm seeing that positive impact. My health is better. I feel better. And I'm going to do the best I can to follow what my doctor says." So, using yourself, also going for your own treatment. If you're struggling emotionally, treatment is always private. Some people feel very comfortable sharing with loved ones in a private setting that they attend counseling, that they receive psychiatric medication. Yesterday, which was January 30th, I was watching CNN, Michael Smirkana's show, and he was talking to a healthcare provider about the tremendous negative impact on mental health that this pandemic has had. I heard the statistic 1 in 6 Americans have gone out, sought out mental health treatment for the first time in their lives. Because of that, some of the stigma is coming down. That may be why somebody doesn't go to treatment. And then I listened more carefully to what the presenter said, And he said the group of Americans, the presenter was talking about every age group and negative impact on mental health during this pandemic. And he did say that a statistical group has been identified as the most least likely to go for mental health care. And I already knew that statistic. The group that was identified is the baby boomer male who lives in the Midwest. The reason why mental health care is refused is because it's viewed as weak, a weakness. And the reality is, for us to go to seek help emotionally with a psychologist or with a counselor is it causes us to become vulnerable. And as a psychologist, what I say, sometimes weakness is good because if we give ourselves permission to be vulnerable or weak, that's what makes us strong. So I know that many of you watching may know that, but not everybody shares that same perspective, and we need to be um, respectful and supportive that not everyone shares our same view on seeking mental health care. The other point the speaker on Michael Smirkana's show said yesterday, which is totally true for that boomer age group in particular, is the healthcare system is trying to address that by having integrative mental health services within medical settings and as a way to try to connect somebody who might be hesitant to contact a provider in the community, a mental health provider in the community. The idea being that when you go to your doctor's office, there's already somebody there who can be called in as part of the medical team to provide the mental health assessment and support. So, first one is everyone's different in how we think about mental health. Stigma can be a problem. Um, the other challenge, I want you to listen when you're being supportive of your family member who are refusing care. Listen to the reason why. And I think that what I see in my practice, I was asked about this a few weeks ago. Do I see mental health stigma? Well, I don't because I'm one of the few providers who specializes in geriatrics. So anyone who's looking for an appointment, I mean, I'm getting people who are looking for appointments who are tracking me down to schedule an appointment. So I don't see the people who are not going to care because of stigma. What I do see is that people who want care, who cannot get access to care because the HMO is cost prohibitive. So I want you to listen. If you've got a loved one who is refusing mental health care and you think that they can benefit from that care, is it an HMO? Are they working age? Is it a $3,000 deductible on the health insurance policy? What I encourage people to do in terms of action in those situations is to look at, some people say, well, I'll pay the copay. And what I say is you need to sit down and look. You might be better off at the next open enrollment upgrading your insurance. Get away from the HMO, go to a PPO, go to Original Medicare, and you actually save money that way because the HMO copays are so high. They're disproportionately high for mental health care relative to a regular office visit. It's going to be $10 to go to your doctor's per visit. It's going to be $40 every time you go to a psychologist or a mental health counselor. So look at the reason why somebody is not going and try to support with that. Okay. Oh, the other very important. If you view somebody as needing mental health care and you're finding yourself getting really distressed about the situation, maybe you live with them, maybe you don't live with them, and you're really concerned about what can you do and everything you try to help, you don't even know how to help anymore because everything you've tried has not been successful. What I encourage people to do is to seek out your own counseling because a psychologist can help you to one, accept the things you cannot change, or to help you understand the situation. For example, maybe a hoarding situation, and the family member may need support. They can't get the loved one into care for the hoarding, but the family may learn how not to feed into or to make, like you can make hoarding worse, but the family can learn ways to be more supportive, more constructive, more helpful. So that is what I'm going to close on is what can you do if someone you love is refusing mental health care? Well, you can go get your own mental health support to help you better understand, to help you better cope with the situation. Okay, thank you very much, and I will talk to you next week. Oh, by the way, everyone stay safe in this snowstorm. Now I'm going to review topics for my February presentations. On Sunday, February 7th, I'm going to be talking about how to provide care to a senior when you live a distance away. So that is going to be February 7th. February 14th, Valentine's Day, I'm going to be addressing a question that was presented by one of my viewers. And that question is, how can I interact with my family when they have completely different views about the world than I do? What can I talk to them about? We can't talk about dinner because they're vegan, I'm not, for example. Gosh knows we can't talk about politics. We can't talk about this because somebody will get upset by it. And so I think that was an excellent question. So I will be addressing that, how to interact with family members who have very different views than I do about one thing or many things. That'll be February 14th. On February 21st, I'll be talking about how to learn more information about the interaction between medical conditions and mental health symptoms. That came to me as a viewer's suggested question. Then on Sunday, February 28th, I will be talking about, oh, how has the healthcare system changed during the pandemic? My goodness. I'm going to be talking about that because that's impacting every single one of us. This week, I had somebody say how, my gosh, one of their doctors just didn't return after having the pandemic, and so some of us are scrambling to find new providers. But the entire healthcare system has changed during this pandemic. Some of the changes will continue. So I'll be talking about that on February 28th. Okay, so thanks again. Stay safe in this storm with all of this snow. Let's lift up and smile. Everyone who has children who love to play in it, or people that have big dogs who love to play in the snow. Tomorrow we will have lots of smiles, joys, and laughter in our life. And remember, the rest of us, we probably are, if it's not okay with our doctors to be out shoveling or clearing, then you need to find somebody else to do the shoveling and the clearing. So stay safe, everyone, stay warm, and I'll see you next week. Bye bye.